What's up, Doc Mike? Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for May 12, 2021. How the COVID-19 crisis in a vaccine-generating powerhouse like India took hold. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, the producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Anita Sheth of the International Vaccine Access Center at Johns Hopkins about how India went from a country donating some of its vaccine supply to poorer countries to being in dire need of those doses today. Let's listen.
Anita Sheth, thanks so much for joining me.
Thank you for having me today, Stephanie.
Anita, today I'd like to talk about India. We have discussed a little bit about what's going on in terms of COVID there. Could you talk to me a little bit about the situation?
Yes, absolutely. India peaked in COVID cases last year around mid-September, and then the curve came down in January and February and started rising slightly early March 2021. And then we crossed last year's peak early April, and it was a steep rise after that. It started looking like a wall, really, and crossing 350,000 cases and 2,000 deaths per day that we're seeing this week. So just in the past week alone, India reported 2.5 million cases, and this is the highest ever number in any 7-day period. And we think that these numbers are an undercount. So the situation on the ground in India is absolutely devastating. People are dying on the streets. There are no beds in hospitals. There is no oxygen to support people. Families are just chaotic. So it is a crisis situation.
And it's heartbreaking because it seemed like India was doing okay for a while. I know that they manufacture their own vaccine, that they had vaccination campaigns. They had even were donating vaccine to other countries. Talk to me about how India has gone from being able to donate to countries that are poorer than itself to now being in real crisis.
Yes, and that is so true. So India is a vaccine-generating powerhouse for the world, I would say. For COVID vaccines alone, there are 2 main manufacturers of the vaccine in India, and together they make about 80 to 90 million vaccine doses a month. But this needs to be ramped up. India was one of the earliest countries to send vaccines to poorer countries for free. So far, India has exported about 70 million vaccine doses. 30 million of them are to the World Health Organization COVAX sharing program. And these donations were sent to the neighboring countries, Nepal, Bangladesh, Bhutan, and others, including far-off places bordering the United States, such as the Eastern Caribbean states. But these exports had to be halted partially in March because there was this sudden surge in cases, and there was also a vaccine shortage that was discovered. So on the home front, India had administered about 140 million doses so far, but this only helped in having 9% of the population having received 1 dose, and only 2% are fully vaccinated as of this week. So it's a drop in the bucket. And there are constraints there, and these constraints are mostly supply-based. The 2 vaccine manufacturers, Serum Institute of India and Bharat Biotech, together are able to supply about 2.5 million doses a day. But India will really need to double this capacity in order to cover at least 70% of the population by the end of the year. And in terms of other vaccines, India's drug regulator has recently approved the Russian vaccine Sputnik for emergency use. And there are several Indian pharmaceutical companies that will start manufacturing it. And India has also allowed for the import of other vaccines, such as Pfizer, Moderna, and Johnson & Johnson. So they are awaiting the emergency use license in India.
What is keeping India from being able to ramp up vaccine production even more? Is it a lack of raw materials?
Well, it's a combination of reasons, I would say. It is the supply chain. Raw materials definitely are required. The recent rule, the Defense Protection Act, was a rule that allowed the American companies to keep the raw materials for scale up domestically. And this actually produced some constraint in the raw materials being sent to India as part of the export. So that was one. But there was also the surge that resulted in major illness devastating families and workers in factories. And so all of this together resulted in this inability to ramp up as expected.
If India had been more selfish with its vaccines, would they be in a better situation today?
That's a tough question. And I think it's important to always remember that vaccine diplomacy has a place in resulting in equitable access to vaccines. So now we have hindsight now, but earlier in January and February, the cases in India had started coming down. So it made sense at that time to be generous and send vaccines. I think that process will begin again because India has the capacity to manufacture vaccines, as we've seen with other vaccines.
I know that we had talked and you mentioned that another problem with the vaccine companies is that the sheer number of people who are getting sick in India. Is that slowing down production as well?
Yes, absolutely. It's important to note that the surge now is just cut across all socioeconomic barriers and classes. So everyone we know, I should say, knows someone else who has lost someone. So families are just absolutely devastated. So workers, so many places have just shut down because people are just desperately either falling ill themselves or looking after family members, trying to find hospital beds and so on. So all of that has contributed to also a decrease in the vaccine manufacturing.
So India isn't just producing COVID vaccine. My understanding is that India produces a very large share of other vaccines for other diseases that the world uses. Will this slow that production down?
So India is a major producer of many vaccines, right? We know that 65 to 70% of the world's children get vaccines that are made by Indian manufacturers. So many of these reasons we just talked about, the illnesses and affecting the workers, the supply chain bottlenecks, and so on, can result in having a shortage of these other routine vaccines. These are the ones that protect the world's children against diseases like diphtheria, tetanus, whooping cough, measles, and polio. Many of these diseases are under control. We do not want to see outbreaks of these diseases in different parts of the world. So it's very important to keep that in mind. And India is trying to ramp up those as well. So these setbacks by these vaccine manufacturers can literally reverberate around the world. So this is something to really keep note of. And it's important to aim for this global equitable access for vaccines.
Mm-hmm. So the Biden administration has eased the Defense Production Act that you were talking about and is now sending supplies to India. Is that too little, too late, or is that going to help with this crisis?
Well, there are different opinions there. I know I've heard this concept of too little, too late, but I would just like to commend anyone who makes an effort to help with the crisis. So just as of today, I think planes have left Washington, D.C., headed to India with supplies that are vaccine related, medicines and oxygen related, and PPEs. I think all of that helps. And it also helps draw attention to the crisis and bring even more support. So I think this is a good thing. Although more needs to be done, and that is certainly happening.
I know that routine vaccinations are very common in India. There's an infrastructure to get vaccines to those who need them generally. Is that in place for a COVID vaccine once it becomes available?
Oh, absolutely. So India has one of the largest vaccination programs in the world. And in the past few years, great efforts have been made to reach those who are remote, to provide messaging to reduce vaccine hesitancy, and so on. So India has done a good job with rolling out the COVID vaccine from January onwards. I think they were available in both the public sector and the private sector, which is also a tremendous progress, this whole public-private partnership. So the infrastructure exists, but it really needs to be ramped up and it needs to be sustained. And people need to come together. The governments, the private sector, and the communities have to understand the importance of getting vaccinated quickly using the existing infrastructure.
What is the lesson of India? I mean, right now, everything seemed to be going well in terms of COVID, and now it has exploded into a really terrifying situation.
I guess there are several reasons to explain that. So one of them is that there are variants that are circulating. The one that has been described is the B1617 variant that has two known mutations that were first identified in California and a second one identified from South Africa. But this variant also has other mutations, and together they likely allow the virus to be transmitted easily and possibly evade immunity. And the government is trying to gear up sequencing. This is the test that helps us understand what strains are circulating. But so far, only 2% of these strains are being sequenced. So this really needs to be ramped up, and the government needs to share data to help us understand what's going on. The other reasons for this surge would also be human behavior, right? So I think the people let down their guard after January and February, and there were too many gatherings in public places for different reasons. And people also started gathering in small groups. Those who were at home taking shelter during the lockdowns last year were unexposed and therefore vulnerable, and they were also unvaccinated, right? So all of that helped drive the current surge right now.
Mm-hmm. And why is this surge? Obviously, it's very important because it's scary, but I think it sends the message that this isn't over until it's over everywhere.
Yes, absolutely. So we have to rely on vaccines. We have to rely on continuing our safety precautions, social distancing, and keeping our masks on. But we know vaccines are generally working, right? Despite all the variants and everything, we see evidence of this. So the elderly in most places, including in India, are relatively protected. So this time we're seeing younger cases and deaths among those who are younger. And those who get infected, despite getting the vaccine, the breakthrough infections end up with milder disease, and deaths are very rare amongst those who are vaccinated. So the Indian Council of Medical Research recently released data that showed that about 1 to 2 out of 5 to 10,000 vaccinated people are falling ill, and these are mild illnesses. So there is an impact that the vaccines are causing, and this is something to keep in mind.
And I guess, but the pandemic isn't over until it's over everywhere, I guess is where I was going with that.
Yeah, that's absolutely right. We need to have the pandemic get over everywhere. So, what I would say to the listeners is that we need to be informed and get involved and not get complacent, because what's happening in India is not something that's remote. Remember, cases came down and then it just rose up again without any warning. So we see that viruses don't respect borders, however much we isolate ourselves and ban travel and so on. So we know that no one is safe until everyone in the world is safe. So as we say in many holy books, so one needs to contribute time, talent, and treasure. So we need help with relief efforts everywhere, particularly in India right now and in the neighboring countries. We need to advocate against vaccine hesitancy, and we need to champion for faster global distribution of vaccines. So this is World Immunization Week, and we can reflect on the theme that vaccines bring us closer. And we all need to join hands to control this pandemic and make the world safe again.
Anita Shett, thanks so much for joining me.
Thank you for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.